continue to communicate with veterans by phone. And again, my number is 816-251-0751. And I have a co-worker, and they're going to hire a new person. So if anyone's interested in the job is today, but you have plenty of time as it is almost 1:30 to go on to the Missouri Veterans Commission's website. You can Google that, or the Missouri State Mo Careers website, and look up for that job for Veteran Service Officer. And so we will have a full-time Veteran Service Officer. We refer to them as VSOs. And I will have a part-time Veteran Service Officer working 2.5 days. That opened up me to be able to get back out into the community and do outreach. But because we are in a pandemic, we will probably work virtually until the pandemic um, is lifted. And so people can call me. I will work with the veteran and get all of their information over the telephone. I will input it into the system. If they are a new client, they will have to visit the office one time so we can capture their signature. And from that point on, the veterans will not come into the office. They can, um, when they come in, they can provide me their medical information. But due to the pandemic, we had to limit the time that we are spending with veterans. So we're available. They can still submit claims. They have enhanced our computer system where we can automatically now submit the claims without having to put them in the mailbox or even having a fax. All we had to do is enter the information and hit that button that says send. And that's as
Outstanding.
quickly as we can get that information in. So that's one of the good things that has come out of this pandemic. It allows us to speed the process of getting the claims submitted.
That is so good. God has a way of making good things out of bad things.
Yes, yes.
And it is with such appreciation that we seize on the opportunity to have Rebecca Bradley on Wave Your Grades here on KUAW.org. And I will say to you that when I encounter, by the way, Wave Your Grades is dedicated to veterans and features American students. And I must make the disclaimer that I am a civilian. I have not
Mhm.
served. I have three brothers who did. But having the opportunity to get to know Rebecca Bradley, Sister Bradley, what I do is suggest that anybody who comes to me with an issue dealing with veterans, whomever it might be, at whatever age, even geographically, if I'm talking to someone in Chicago, I will ask them to call 816-251-0751 for any matter that deals with veteran affairs, because if you don't serve it, you can direct them.
Yes. As a matter of fact, that's one of the good things about, again, that came out of this pandemic. And even before then, the VA changed their system. Now they have one centralized intake center.
Wow.
Before, we would have to send their, if we work with someone out of town, uh, or if they live, like they live in Kansas, because, we're sister states. I would have to send their paperwork to Wichita. I don't have to do that anymore. We
Oh,
just send it to one centralized location. And now that we're doing things via computer, it's going to be the same way. I'll intake your information, and if I have their signature, because I get phone calls all over the state. But for the most part, what I do is advise them.
well, as I request from you your closing remarks for today, I
Hmm.
am going to ask for something of a change. And
Hmm.
that is that we have been blessed to have Rebecca Bradley on the program once a month, and I will be asking, if given appropriate notice, if you might be called upon more frequently than once a month.
I'm available. If I am not doing anything on certain weekends, I'm available. But with this pandemic, I'm like everybody else. I am stuck in the house.
Exactly.
But if I'm free, feel free to call on me.
Absolutely. And as a matter of fact, in some ways, again, God works in mysterious ways. Our having the availability via phone in some ways makes it even easier, because if there's weather, if there are transportation situations, the phone can make it even more convenient. But please don't be surprised when you are called upon.
Okay, I won't be.
Final
And
remarks
because
from.
I enjoy being on your program, one. Two, I enjoy getting information out to veterans. And one thing I want the veterans to know too is this this pandemic, we have lost so many people.
Yes.
One of my NAVAT brothers, um,
Mm.
he is very good at just keeping people informed, what's going on in the community. But one thing I do want to tell people is if you should lose a loved one, there is veteran cemeteries that they should consider, particularly if a veteran dies or if his spouse passed away and he's still living. The spouse can go into the cemetery while he's yet alive.
Yes.
And if a spouse passed away um, after their veteran loved ones, they are eligible, which they probably do know, to get into that same cemetery with their loved one, provided they never divorce.
Thank you, thank you, thank you. That is so important on a personal level. My wife and I witnessed the burial of her parents together at Fort Leavenworth.
Yeah.
So.
And so, yeah, we got state and federal cemeteries. So they should keep that in mind too.
Well, and we'll hopefully get an opportunity to have you on with Debbie Austin, who is a Gold Star mom who has been on the program a few times, and have that conversation. But thank you, thank you, thank you. And do you have closing remarks for us?
Yeah, I want everyone to remember to wear your mask. People are still dying. People are still getting infected. I know a lady who was a nurse, had her PPE on, and still got uh, this disease.
Wow.
So wear your mask, wash your hands, try to be distant so we can all come out of this together. Call
Thank
me if you have any questions.
Thank you so much, Rebecca Bradley. And you and I did not discuss it. You have offered the perfect segue. We're getting ready to call Dr. Jasper Fullard, who has been on the air talking about the pandemic, the protocols, as well as the advisability of using the vaccine. So thank you for that perfect segue.
All right. Thank you. God bless you.
God bless you.
Bye-bye.
Bye-bye. Rebecca Bradley, Missouri Veterans Commission, Minority Affairs, 816-251-0751. 816-251-0751. Rebecca Bradley. Wave Your Grades is brought to you by Stutes for Boots. And the Stutes for Boots organization is a program that asks American students to strive for excellence in honor of our troops. A part of our Stutes for Boots campaign is to have the program Wave Your Grades Saturdays from 1 until 2 p.m. here on KUAW.org. Knowledge, understanding, and wisdom Louis George Walker, founder of the program, is also our producer and engineer on Saturdays, who might indeed join the conversation. We emanate from the W.E.B. Du Bois Learning Center in Kansas City, Missouri. And we are singularly blessed to have this opportunity to get the word out and to allow the young people to participate. Those of you who listen regularly have observed that we have not had the young people on the program so far, 2021, based indeed on the pandemic. One of the things that Attorney Valencia Broadus has observed, and our own DeQuay Wilson announcer, is that they really appreciate Louis George Walker and KUAW for allowing them to bring young people in to see how these things work. And now we are blessed to have on the other end Dr. Jasper Fullard, and would like to welcome him to the program. Wave your grades. Dr. Fullard, are you with us?
I'm here, yes.
When you have appeared recently on local television and maybe beyond, we have watched local TV. I think that they suggested being a part of the Healthcare Coalition, but please introduce yourself with proper nomenclature.
Yes, it's Jasper Fullard Jr. I am a retired internist in the Kansas City area.
And, I'm sorry, go ahead.
Okay, I guess that's all the information you need about me personally. But I'm also the founder of the Black Healthcare Coalition, an organization that's been around for about 31 years now. And we are about disparity in health care for the black community. And I'm concerned because of a lot of blacks refusing or indicating that they may refuse to get the vaccine. And this concerns me because, number one, we are the ones in the community that have more issues with all of the health issues, health problems. If you think of any chronic diseases, we are the one dying 5 to 10 years earlier than our counterpart. And obviously, in a problem like the coronavirus, it's just the same problem. We would be the one that would get the virus and that will die first, certainly much earlier than our counterpart. And we are the one that probably will have more problem getting into the hospital and into the emergency room if there's a problem with priorities. This concerns me a lot. So we as an organization are trying to encourage the black community, black people, to get the virus, get the vaccine whenever it's available. I know there's a concern in the black community. There's always been concern about whether or not they're being used and whether or not experimentation is a problem. And the Tuskegee experiment always come up as an issue.
Now, my understanding is you have some very personal knowledge about the Tuskegee experiment.
That is correct. I was a student at the Tuskegee Institute during the time that a lot of patients were coming to the hospital. I must explain that the Tuskegee Institute has its own hospital called Johnny Andrew Hospital. The VA hospital was only a few miles from the Institute. And I was working at the hospital there as an orderly, and a number of patients was being admitted to the hospital I noticed that most of these patients had to use a wheelchair or some means of getting back and forth. And taking these patients back and forth to get their treatment, it was noted that these patients had syphilis. And syphilis was a disease that was a big issue those days because a lot of the soldiers were coming home from the war. They had syphilis and was being spread throughout the community from the veterans. And I didn't know a whole lot about syphilis, obviously, at that time, and didn't know anything about the experiment. But later on, I learned that the experiment was being conducted at the VA hospital, and this started way back in 1932, where these soldiers, veterans, were being used in this experiment. And I also learned that the black veterans were being used as a placebo for the most part, which means they did not receive the medicine. Penicillin was probably a very popular antibiotic at that time, but the white patients were given the penicillin for treatment, but the black soldiers were not being treated with penicillin. They were being given the placebo. As a result of that, as time passed, and of course this lasted over a period from 1932 to 1972 or 71.
That's amazing.
And over this period of time, not receiving any treatment for syphilis, they actually developed some very devastating neurological and physical defects. And this issue was detected after some of the black doctors who were participating in the study, but did not have all the information, and certainly did not know that the penicillin had been proven to be working to cure the syphilis. Once they did find out, however, they did get together and they sent a letter to the National Office for the Veterans Administration, and it created a very, very bad situation in terms of racial discrimination at the VA hospital. And this became the issue was so severe that the veterans recommended that a national overview organization be created, organization that would review all the research that was done, so this would never happen again. Because of that, now we have a local and national review organization, so this cannot occur again. So I don't want us to continue to use the Tuskegee experiment as an excuse for not receiving the treatment that we need. Certainly, we need the treatment more so probably than the whites to prevent this deadly disease from having its devastating effect on our community. So that's the thing that we want to get across, that we should not be still talking about the Tuskegee experiment and using that as an excuse for not getting vaccinated.
It's interesting that you mentioned that, and I think that when we discussed, I've got some time on you. I'm older, but I will soon be 80. And
no, you're not older. I'm 81.
Get out of here. Get out of here. I did not realize that. I thought I had you by at least some months. But you and I can identify in this way. And this is very interesting from a sociological and historical perspective because in our being Black Americans, and particularly males, we have talked in the last few years about giving our young men the talk. Now, at our age, when they talked about your parents having the talk with you, it was about male-female relations.
Right.
And we grew up almost honoring penicillin because we were concerned about the gonococcus or gonorrhea
Yeah.
and the spirochete dealing with syphilis, and that being almost ingrained in us as far as run to the doctor and get some penicillin, something might be wrong from that standpoint, to also being that generation that suffered discriminations that brought on the civil rights movement.
Mm-hmm.
My question to Dr. Jasper Fullert, founder of the Black Health Coalition, do you find any difference in the suspicions as it relates to age groups? Is it more those of us our age who saw what was going on, or even younger people?
Well, you hear it now from a lot of the young people. I think they've gotten the information from the older people about what happened many years ago. But certainly the older people are very much concerned and can remember some of the things that might have occurred during that time.
Well, I'll tell you what is encouraging. We often say young people learn more by example than they do by instruction.
Right.
And when we see the examples of Black people in medicine taking the lead and appearing before us, accepting the vaccinations, that's certainly helpful. What does Dr. Jasper Fullert have to tell us about how we can help? And by the way, I mean, we are the ones, those of us who are older, who need to abandon those suspicions. How can we help get the word out or persuade them?
Right. Let me say something. During my practice for about 40 years now, I did about 9 studies. In other words, I was a principal investigator of about 9 studies.
Wow.
And the studies that I had an opportunity to be involved in, of course, were not studies involving new drugs. These were usually drugs that were on the market, but they were trying to determine whether or not they were effective in Black patients. What we need to get across to Blacks, when you hear studies being done, most of the time the participants are white. A very few Blacks were involved in most of the studies that have been done. Now, why is that so important? I can give you at least 2 or 3 examples right away that created an issue for Blacks. Some of the medicine that have been invented don't work quite as well in Black as in whites, and vice versa. One good example of that was the calcium channel blockers that came out for treatment of blood pressure in Blacks. Most of the participants, I think it only had about 200 or 300. Very few Blacks participated in that particular study. Well, when the medicine was created and they were using it to treat Blacks and white patients, it was later proven to be more effective in Blacks than whites. That was a very positive thing for Black patients. But then there was another drug, the ACE inhibitor that everybody probably hear about, and a lot of patients are on.
Yes.
Was being used to treat blood pressure for Black patients. Lisinopril is one of those drugs.
Yes.
And lisinopril is not a good medicine to treat the blood pressure for Blacks. It works very well in white patients, but not very well in Black patients in terms of treating blood pressure. I don't want to indicate that it doesn't work at all. I'm just saying it's not a very good treatment for blood pressure in Black patients. That was determined in a study called the All Hat study, which I was one of the principal investigators.
Wow.
They had about 45 1,000 participants in that particular study overall, and had about 1,000 and some odd blacks that participated in that study. It was determined that the blacks that was getting this lisinopril to treat the blood pressure, there was a higher incident of strokes in that group because the blood pressure medicine was not controlling that blood pressure on a 24-hour basis. Did not say that you didn't get any results, but it's not very effective in controlling your blood pressure over 24 hours. In the white patient, it was just the opposite. They were getting much better control of the blood pressure. Because of that, they had to unblind the study and take the black patient off of lisinopril and put them on medicine that better control their blood pressure. That's the way the study's supposed to go. And that's what happens in studies today. If it's proven that the medicine works better to control whatever the illness that they're trying to control, they have to unblind the study and switch the patients that got placebo and put them back on the medicine that they need to have to control that problem. So this is an example why blacks need to participate in studies. And I'm not suggesting that every study come out you need to jump in, but there need to be more understanding, and patients need to know why they need to participate in studies.
Wow, this is extremely enlightening. And if you did comparative studies or comparative analyses, and for instance, lisinopril versus amlodipine, something like that, I am not hearing you say that lisinopril is necessarily dangerous, but it just isn't as effective as desired.
That is exactly what I'm saying.
Mm-hmm. And when we consider today that you have at least 4 studies or 4 availabilities of vaccines, I think more than that, as we observe the different strains, is there a particular vaccine that you recommend above another?
It has been proven the one that we have now, the Pfizer one and the Moderna, those vaccines work about the same. Mm-hmm. We don't think there's a major difference between the two. The difference is that the Pfizer, that's the one that I've had. The Pfizer one, you have to take your booster shot about 3 weeks later, at least. And the other one, the Moderna one, you have to take it in about 2 weeks, roughly. So there's a difference there, but the outcome and the profile in terms of the side effect profile is about the same. And my wife and I both have had our vaccine, had no problem, no side effects of any concern. It's just like taking a flu shot, really.
And Wanda and I are lining up to get ours, and we're at the requisite age, so that is helpful. Let me just ask before we get to the end of the hour here, the degree to which politics do not help as we are attempting to attend to the medical needs of our community. So
you're right about that. I think, unfortunately, Trump has created a big problem for this vaccine, and we're going to have to overcome it somehow. But politics has been a bad thing in terms of getting people to believe in the vaccine. So we have to try to overcome that, to try to answer the question that people may have and encouraging them that they need to take the vaccine.
Now, once again, as long as you and I have known each other, and I'm being very honest when I say I did not realize how old you are, and you have the right to enjoy some rest. I suspect that you're being called upon more now than before because you are needed in this time. Should I recommend that someone call you for an interview such as this? Are you teaching? What is going on in the life of Dr. Jasper Bullitt at this time?
I am enjoying my retirement.
Yes, sir.
And staying out of my wife's way as much as I can.
Okay.
So I'm not doing anything in terms of any formal type of activity, other than with the Black Healthcare Coalition, the things that we're doing. But
and thank you very much what you are doing at Ebenezer AME, and we will be reconvening soon, I pray. The pandemic obviously has hit us too, but just mention, please, for our listeners what that coalition does.
You mean the Black Healthcare Coalition?
No, the program for youth at
okay.
Ebenezer.
Yeah, we were having some meetings with our young people, trying to educate the young people and get them motivated to do things when they finish college. I have a program at our church called Pre-Medicine for Youth.
Oh, man.
It's a program where I'm trying to start early, indoctrinating them and getting them interested in going into medicine profession, because we have a shortage of black doctors. That's a big problem right now. And we meet at the church and meet second Sundays after service and go over things. I know that they're not taking in a whole lot about medicine per se, but at least giving them enough information that they know what we're talking about when we're talking about medicine and the different kinds of, specialties in medicine.
Oh, man. That is.
So I have
great.
Another doctor, Dr. Lee, at the church. She works with me. Has some nurses that works with me, and we haven't met obviously in several months because of the virus.
Right.
But I'm interested in making sure we encourage more blacks to become interested in medicine.
Well, we're coming to the end of our half hour with Dr. Jasper Bullitt. Cannot thank you enough, not only for your knowledge and information, but also for encouraging us to take advantage of what is becoming a cure. And we are prayerful, obviously, that within the next few months or year or so, there's something called normalcy. But in the meantime, we need to listen to Dr. Jasper Bullitt. Any final remarks for us?
Not really, other than repeating the remarks that I've made.
Yes, sir.
I just want to make sure that people understand that there is no big risk in taking the virus. It's just like taking the flu vaccine.
Mm-hmm.
And I would say to some of those who have reaction to shots, who have allergies to peanuts and severe reactions, anaphylaxis type reaction to anything, bee sting, what have you, that you contact your doctor before you do the test. It doesn't mean you can't have it. It just means it has to be done in a controlled situation, so you treat it if you need to.
I know some people with allergy to fish oil, fish type products, but whatever it is, you're saying check first.
That's right. If you have a severe reaction to anything, or you have to end up carrying an EpiPen, going to the hospital, anything like that, then you want to check with your doctor before you have the shot done.
Dr. Bullitt, I cannot thank you enough. And by the way, you came on with short notice, so thank you so much for that. We will continue to be in touch. And God bless. God bless you and Mrs. You.
Okay, all right. Take care.
You too. This is Wave Your Grades on KUAW.org. My name is Carl Boyd. I'm your host, Dr. Jasper Bullard, Sister Rebecca Bradley. What information. And as we leave today's program to students across the USA, your Stoots for Boots message for this day, January 16th. When you, students, look down at fallen warriors, you're looking up to heroes. Salute their sacrifice with your success. Gracious God and wonderful Wanda, I'm on my way home.